Give me a thumbs up if you can hear me, Dr. Nandyala. Good, awesome. So we'll just wait just a couple seconds, and it is 12 o'clock. So we'll go ahead and get started. Well, welcome everyone. We are so excited to be here. Thank you so much for joining us for our webinar. This is the first webinar that we're doing with Ascends Natural Medicine, and we are so thrilled to be going over this incredibly important topic. We're going to be talking about hormones and hormone havoc and what you need to know. So just a few housekeeping before we jump in, and I introduce you to this incredible healthcare provider and doctor and a dear friend of mine. So if you are joining us, understand that this is being recorded. We will send you the recording so that you can go back to it, stop, play, pause, rewind, and go back to any questions and stuff that we go over on this webinar, so you will have it. Also, if you have any questions at all, comments, feel free to type them in the chat box. We would love to engage with you and interact with you. There is no such thing as a silly question. We hear so much being in this field, and there's really nothing that we haven't heard before, so we would love for you to type your Q&As in the chat box, and we will get to that. So without further ado, I'm going to go ahead and turn it over for Dr. Nandyala with Ascends Natural Medicine to kick us off. But before she unmutes herself, I just want to share a little bit of my relationship with her, my partnership with her. I serve as, kind of her patient coordinator, education, practice development specialist. And I will tell you, over the last year and a half that I have been working with her, I have found that the sincerity and the passion and the true love that she has for her patients and really helping to identify root cause of symptoms, things that we feel that we know aren't normal, but maybe our PCP or our OBGYN says everything's normal, don't know what else to tell you. I will tell you that's not the case with Dr. Nandyala. She will be committed, and she is committed to really getting to the root cause and finding out what is going on at the root level. And that being said, obviously that means that she is working with her patients to make sure that they achieve the outcomes that they desire. And that's what this is all about. It's all about making sure that we help the body heal in the way that it was designed to heal. And she is an expert at that. I've really enjoyed getting to know her over the last year and a half, I think it's been. And I can't wait for her to get started. So I'm going to go ahead and unmute her and have you kick it off. Dr. Nandyala, how are you? It's very nice to see you and hear you. Let's see. There we go.
Wonderful. Thank you so much, Jenny. That's amazing. Thank you for all the great introduction. And good afternoon to everyone, and welcome to Ascends Natural Medicine's monthly webinar. This is our first webinar, so we are very excited for it. I'm Dr. Nandyala. Like Jenny said, I'm very passionate and I love what I do as a naturopathic doctor. And I believe we have a high need right now for physicians who actually pay attention to the root cause of the disease rather than going over just bandaging the symptoms, like as exactly what Jenny said before. Here at Ascends Natural Medicine, hormone therapy is one among several modalities that we take pride in, that we treat our patients with, and education is one of the key factors. And I'm glad that you're all here today, and we can go over our most important topic, which is hormone havoc. Yes, it is a havoc, and it's not a joke when I use the word havoc, stating that hormones, what are all the symptoms that they're responsible for. And I'm sure we all know on our day-to-day basis, starting from even 25 years of age, everybody is starting to get these early symptoms of like hot flashes, weight gain, trouble losing water retention, osteoporosis, joint pains, hair loss, lack of energy, mood swings, low libido, and so on and on and on and on. And I'm sure you all can relate to me when I say that 2 o'clock afternoon fatigue, it's not a good thing. And most of the time, it can come up from several different hormone issues. It could be your thyroid, it could be your adrenal glands, it could be your pituitary gland, it could be your male-female hormones like estrogen, progesterone, testosterone, and we have cortisol, DHEA. There's so many things that a general public have no idea about. And when they come see me, they go over, doc, isn't this estrogen the only thing that females should have? Or testosterone, isn't that the only thing that males should have? So that's why education is very important. And so today's topic is to dispel any of the myths and misconceptions we have regarding the bioidentical hormone replacement therapy. And yes, the hormone replacement therapy has been in the medical mainstream for several years in the form of synthetic hormones. If you're getting estradiol patches or shots, and there, of course, there are a lot of side effects that comes with it, like cancer-related issues, if you're getting tumors, fibroids, so on and so forth. And recently, bioidentical hormone replacement therapy has been on the hike, and I've been getting several calls from new patients, like concerns. I heard this about, I'm going to get cancer or breast cancer or fibroids, so on and so forth. So today we're going to go ahead and go over what these myths and misconceptions are, and is there any truth behind them. So Jenny Hefe, and I love her just like she loves me. Amazing person. And she's also a great educator. So she's our patient educator specialist here at Essence that helps our patients learn more about hormones in general, what it does to your body, and how we can address these concerns. So today she's here to go over those issues with you. If you have any questions, concerns, any other topic that you would like to go over while we are targeting the myths and misconceptions, please go ahead and otherwise, Jenny is good to go.
Okay. Awesome. What I'm going to do, just for feedback purposes, I'm going to go ahead and mute you, and then just give me a signal or type in the chat box anytime you want to interject. Is that okay, Dr. Nandyala?
Gilbert.
Okay, perfect. All right, so we're going to go ahead and get started. Just like Dr. Nandyala said, we are going to really kind of go over this overview of hormones. What roles do they play in our body, dispelling some myths and misconceptions, and understand everything that we do at Essence is evidence-based medicine. So we back everything up with hundreds and hundreds and even thousands of evidence-based literature. So we're going to start our webinar off with this quote. This is something so near and dear to our heart. Wouldn't it be amazing if we could teach people how not to use medicine to heal their bodies? What if we could live in an environment where our healthcare providers, all of our healthcare providers, were really working with people to stay well rather than spending their time dealing with symptoms and dealing with disease? What if we could actually help the body heal itself from the inside out? And that's exactly, I think, everything ties back to this one quote from Hippocrates: the greatest medicine of all is to teach people how not to need it. So a big important part of our hormonal and human health is hormones. So to set the stage, I want to talk about the difference real quick, briefly, between treating a disease state and healing a disease state. When you treat a disease state, the context of that disease state remains the same. Nothing changes. You're literally just treating the symptom so you don't feel the issue associated, but it doesn't mean that you're removing the actual context. Now, when you heal something, the clinical response that is elicited is to bring about an absolute healing of that disease state. And that's the difference between treating a symptom and really digging into the root cause and starting at that root cause. That is what we're committed to do. Furthermore, it's really important to set the stage in understanding the difference between natural types of therapies that your body recognizes as its own versus synthetic types of therapies, okay? So we call this root cause versus Band-Aid. And I'm not gonna read the slide, but what I will do is just submit for your consideration this analogy. Let's say I give you a treasure chest, and in that treasure chest is all the treasures that you could ever possibly want, need, or desire in your entire life, right? You can fill in the blank for that. And I'm going to give you 2 keys, and one of those keys is not only going to go in the lock, it's going to turn the lock, and it's going to open up all this incredible treasure. But the other key will just fit in the lock, but it won't open it up. That is the difference between bioidentical hormones that your body recognizes as its own versus synthetic. Synthetic hormones will find that cell, and we'll talk about that in just a minute, and it will fit in kind of this lock in the cell, but it just won't turn it over to unlock and unleash all of the wonderful health protection and benefits and prevention that our hormones in our bodies are designed to do. Whereas bioidentical hormones, and when we talk about those hormones, I will identify them, but ones that our bodies find as natural will go into that cell, unlock that receptor, unlock that treasure, and the heart benefits, the brain benefits, the bone benefits, the breast benefits, the prostate benefits, the skin, the eyes, every single body system has beneficial responses because of that. That is the difference between treating a disease state and healing a disease state. Remember that injured tissue and systems do not heal with drugs. They heal with nutrients. So our job is to find out what is missing, what's the missing piece, and how can we start at that root level. All right, so drugs treat symptoms of menopause and andropause. I will define those definitions in just a bit. All right, so again, further to set that stage, when I talk about hormones and when we are educating patients on the importance of hormones, I try to keep it very simple. Everyone knows that we have trillions of cells in the human body. And to just kind of paint this picture for you, every single one of those cells in your body has what's called this receptor. And a receptor is a lock, right? And something is supposed to go in that lock, and it's supposed to turn over that lock, and it's supposed to help the cell act and behave the way it's supposed to. So let me just go ahead and expand on that a little bit. Every cell in the human body has a receptor where hormones, which are chemical messages that tell your body how to act and how to behave and what to do, hormones are supposed to go into the receptor, go into the cell, unlock all the benefits. It's just that simple. So with age, when we start our production decline, when we start declining in the production of our hormones, our cells are not getting the adequate instructions on what to do, how to act, and how to behave. That's incredibly important in the grand scheme of chronic illness and disease as it pertains to diagnoses in our 40s and 50s and 60s and beyond. So that's what we're dealing with. We're dealing with a body, a human body that has been designed that every single cell in that body is supposed to have hormones in them. That's pretty impressive, and it's pretty incredible when we start understanding the science of the human body. It is not natural for us not to have that instructions to our cells. Hopefully that made a little bit of sense, Dr. Nandyala. Do you think that that was a good explanation? Okay. So when we talk about what hormones matter, today we're not going to get into the some 50 different hormones that your body produces and secretes. That's just too much. But I will tell you, everything points back to a hormone connection or disruption, period. There is no argument when we look at even our hunger signals. That's all hormonal related, maybe not sex hormones, but we produce and secrete some of 50 different types of hormones, all of which are incredibly important. But today we're going to talk specifically about sex hormones, testosterone, progesterone for women, not for men, estrogen for women and men, same thing with testosterone, women and men. Vitamin D. Vitamin D is a hormone, and it was misnamed when it was discovered way back then. But vitamin D acts as a hormone in your body. And what we found, 2,500 plus studies say that testosterone and vitamin D, when they are declining, then that is a really bad combination for chronic illness and disease. And I have a question, and I will absolutely answer question. Perfect. Okay. I will answer questions at the end so that we don't get off topic. But vitamin D, it is a hormone. It acts like a hormone in the body. And sometimes that nutrient in that vitamin is so incredibly impactful by itself, even in helping relieve some symptoms and really getting to root cause. And thyroid is something that Dr. Nandyala is so experienced on. Thyroid is a hormone. We need to be able to understand thyroid in an advanced manner. We're not going to dive too much into thyroid today, but thyroid is equally important. And these are our main hormones that we're going to be discussing today. If you have any questions, please, again, type them in the Q&A box. Did you want to say something, Dr. Nandyala?
Yes, regarding the thyroid, since we are going through the testosterone, estrogen, progesterone, I do see many patients that come in and say, well, I have a thyroid problem and I've been on medication for it. And that's all they think about is that, well, why am I not better? Isn't my thyroid fixed? So why am I not feeling great or going to the job with a lot of enthusiasm? Why am I having stress and fatigue? Because all of these things about that you mentioned, they work in conjunction.
That's right.
Just like vitamin D, it's not a vitamin that you could just say, well, it's fine if I don't have it. It's a hormone, and it works with testosterone, progesterone, estrogen, and thyroid, and depression, mood disorders, immune function. So it's important to know that they play multiple roles rather than just be a simple hormone or a vitamin. And you are right on target with that. That's amazing.
That's exactly right. All of our hormones, our bodies are created in such this magnificent fashion. All of our hormones work together synergistically and also on the flip side, oppose when needed. It is an incredible thing that our bodies can do if we have the right starting point, the right nutrients. So absolutely 100%. So we're going to go ahead and jump into estrogen. And something that I really like to make a point of is symptoms that you may be feeling, and you can read them on the screen. Symptoms that you may be feeling may be an indication of hormonal imbalance, different types of hormones, but more importantly, symptoms can lead to increased risk of disease. So this is the education. When we talk about sex hormones, it is not just about helping people feel better. Yes, we will help you do that. But we are more so committed to helping to prevent heart disease and brain disease and bone disease and breast disease and prostate disease. That is what our end goal is. And hormones, the symptoms are a sign to us that say, hey, pay attention to me. Something is wrong. So hot flashes, different than night sweats. Hot flashes are this burning right here in your décolleté, and they kind of go all the way up to your neck, maybe last for a couple minutes, and it's horrible. Night sweats are just breaking out in sweats any time of the day. Doesn't have to be at nighttime. Those are two different hormones. We'll talk about that in a minute. Mood swings, irritability, anxiety. 1 minute you're fine. The next minute you're biting someone's head off. That is not normal. That is a fluctuation potentially happening in your body that needs to be addressed. Your body is telling you, pay attention to me. Headaches and migraines, especially around a menstrual cycle, we see that all the time. That is a sign. Your body is giving you a sign. Joint pain, muscle pain, bone aches, dry skin. I was just yesterday at a veterinarian with my kitty cat, and I was talking to her about hormones. We just got on the subject. I don't know how in a veterinarian office we actually got onto the hormone discussion, but she showed me her hands. She goes, my hands are so dry. My skin is so dry. That is a symptom. Your body is telling you, pay attention. Bloating, depression, and so on and so forth. So if you have experienced any of these symptoms, that is, okay, write them down and let's take a look. Let's see if there's something that's wrong. It's your body telling you something is wrong. Androgen, testosterone, again, similar types of systems, just like Dr. Nandyala said, our hormones work together. You can't have one without the other being balanced as well. They work together. So a loss of energy. Are you extremely fatigued? Can you take a nap at 2 o'clock? Can you fall asleep and wake up and still not feel refreshed? Do you have brain fog? Are you forgetful? Can you not formulate sentences? Are you not quick on your feet? These are your body's symptoms telling you something is going on. What about weight gain and the inability to build lean muscle mass? Of course, depression, irritability, moodiness, lack of libido. How is that part of wellness in your life? How is your sexual wellness with your spouse? How is that? Do you have that desire? This is your body telling you something may be wrong. Of course, for men later on, depending on their levels, is erectile dysfunction and ability. So all of these, again, are symptoms that we experience sometimes in our 20s, and we discredit them, and we do other things to treat them, but we're never getting to the root cause. Dr. Nandyala, do you want to go ahead and add anything else to that?
Yeah, actually, there's one important thing. So when I see my patients, majority of them, the elderly patients, they have this big concern. Why do I even need these hormones? I don't have a partner. I'm retired. I don't have much work to do. And I don't have hot flash. I think I am okay. I'm not trying to bite off other people's head, but why do you want me to go on the hormones, or why is it necessary? So that is a big problem, because we're not doing just for libido purposes or for you to have like a better mood, but it's for your osteoporosis.
Right.
That's another concern for females, even for males as well, is think of your bone health down the lane. You don't want to fall and break a hip and have concerns at that point. And so that's why Jenny comes in. When you learn that estrogen, testosterone, progesterone, they actually help you build that stronger bone. So it's not just for like, I don't have a partner, so we don't have to worry about that. But this is for everything else, like dementia, for Alzheimer's, for your heart-related issues, and for adrenal glands. Are you managing everything else? And that's where the hormones come into. So.
Yes, absolutely. It's jokingly, I kind of say, well, if you're 80 years old or 90 years old, or I don't care how old you are, do you still have a brain in your head? And do you still have a heart in your chest? And do you still have bones in your body? And do you still have skin? If you answer yes to that question and you are alive and breathing, you need hormones, right?
Absolutely. Absolutely.
All right. So this is a very important slide for me. It hits really close to home. I would love, Dr. Nandyala, is it okay if I just kind of shared my story on how I started? Because
please go ahead.
I really think that, people can relate to that. When I was 35, I started feeling all of the symptoms that were on those slides. I won't get into that. All of that led me into my primary health provider, which was my OB-GYN, my gynecologist, really the only provider that I've ever been to, because I had my kids and I was healthy and all that good stuff. And I presented, I said, I'm just tired and I'm depressed and I have no libido and I have brain fog. And I was just expressing all my concern. And I asked them, will you please run a hormone panel? I knew a little bit to be dangerous with, not a whole lot, but a little bit to ask if she could run a hormone panel. Her initial response was, are you still having a period? And I said, yes. She goes, is it regular? I said, yes. She goes, then it's not your hormones. And I was kind of shut down. So I didn't like that a whole lot, because I'm one of those that I want to know what's going on. So I insisted and persisted that, will you please run a hormone panel? So reluctantly she did. I go back a couple weeks later, I'm on the table, and quite honestly, I was excited to hear how bad off I was, because it would validate all the reasons why I felt the way I felt. Not that I really wanted something to be wrong, but I felt so horrible. I knew that appointment that I went to was going to tell me, it's not in your head, something's wrong. So she puts her hand on my knee and she says, everything looks great. Everything is normal. There's not a thing wrong with you. And I kid you not, I went from a posture, this erect posture, excited to hear about what was wrong with me, to this defeated posture, feeling like I was crazy and it was in my head. So the answer, and this slide is the best slide I could possibly come up with, was a prescription for Prozac.
Wow.
And I say that to you because, of course, I pursued second opinions and I found this incredible answer, which is the reason why I work and operate with doctors like Dr. Nandyala. But I realized that my body does not have a Prozac receptor. My body doesn't make Prozac. So I certainly cannot be deficient in Prozac or Ambien or Xanax or any of those other issues that was the remedy, because my current physician back then was not advancedly educated in this topic. So of course I got relief, and that's another story, but this is not the answer. Drugs are great for a period of time if that intervention has to happen. But if we can help the body heal itself and look at natural ways of helping your body, that's going to be the best response that your body is really calling for. So that's my story. I briefly want to talk about these two phases in women and men's life, but this is not just confined to these certain age groups, so I don't want to confuse anyone. But this phase—
That's amazing, actually, Jenny. You brought that topic, like your story, because most of the youngsters, or that we call ourselves young, between that 30 to 40, they're thinking, well, I'm too young to have hormonal issues. And unfortunately, in my practice, by 23, 25, and I'm already seeing a steep decline in hormones. It could be because of constant stress that we go through every single day, or did you have a motor vehicle accident where you had a whiplash, concussion, affected your pituitary gland, that affected your estrogen, testosterone, progesterone. So there are so many several factors that play a big role. And when I talk to them, they're, well, I'm too young. I just had a baby 2 years ago, 3 years ago. I shouldn't be having these concerns. So thank you so much for going over your story. That gives a hope that, you know, everybody else can have them hormones checked and figure out what's going on.
That's right. And what she was talking about and experiences, I was experiencing this period of my life where my hormones were kind of fluctuating and they were declining. I did have several head injuries as a young adult. And looking back, we think that that was the catapult to the decline of my production of some of the hormones that we're going to talk about. So head injury, lots of correlation with hormone deficiency. So if you've had head injury or someone else has had head injury, you may want to help get their hormones checked. But perimenopause is typically, you know, this 2 to 8, sometimes shorter, sometimes longer period in a woman's life where her hormones are going crazy. This is right before that push to where she stops menstruating. And that could be in her 40s, that could be in her 50s, that could be in her 60s. It really just depends on the female. Menopause is only one day in the life of a female. And that means that you have successfully gone 12 months without any type of bleeding. So for that one day, you're in menopause. Every day before that is before, every day after that is after. So we're talking about this phase where when these women start feeling issues, and like Dr. Nandyala said, you know, sometimes in their 20s, their doctors don't know really what to do with them. Like my story, my doctor didn't know what to do with me because I was still having a menstrual cycle, so it couldn't be my hormones.
Right.
It is. 100%. So perimenopause and even premenopause, these are real things, and we're seeing them younger and younger and younger in both men and women. And this is actually, I want to say, even an outdated slide. I'm sure you would agree with me, Dr. Nandyala, because we are seeing men, especially retired athletes, that played ball, college ball, stuff like that, in their 20s with severely low testosterone. When we say andropause, we see that that's kind of the equivalent of the menopause, so to speak. But you can kind of see that every single year, again, as a male ages, just the same thing with females, we start producing less and less and less and less of our hormones.
Unfortunately, in my practice, I've been seeing that 40 years range, but a 60 years of decline, like, you know, what 60 years, we are seeing it 20 years ahead of a time.
Yeah, I'm going to explain that. I'm going to share my labs way back when I was 35 and just kind of give someone a scale, give the audience a scale, because it's so telling to what we're going to discuss. So people always ask us, what is normal? Number one, I want our audience to understand that normal is individualized to you. My normal is completely different than what your normal could be. Everything that Dr. Nandyala does is tailored and individualized to you. So these numbers may not be normal for you, but we always have those questions, right? Dr. Nandyala, well, what should my numbers be? So
that's a big question.
Yeah. So men typically will lose up to 10% of their testosterone production year over year over year. So that means that the next year they lose up to 10% lower, and so on and so forth. So you can kind of see that decline. Women, my ladies, we lose up to 50%. This is horrible.
It is.
After 30 or after we start having babies, sometimes earlier. And this is where women are getting diagnosed with depression and anxiety and irritability and mental nervous disorders, because our testosterone, you're going to see this in a minute, we have them, receptors are rich in our brains, and that's what also equates to these symptoms that we're feeling. But if you're looking for a lab reference range, number one, we don't look at total testosterones for normal. We look at what is actually happening at the cellular level. So that's a different test that we take, which is also different than many, many other providers. But typically women feel better between 80 and 150. Now that doesn't mean that that's actually going into their cells. That's the total number. Like I said, we take a different number and we look at a different lab to see what's actually making it into your cells. We won't get into that today. And for males, we see it much greater than 900 is when they say, I feel amazing. This is how I felt when I was, 25 years of age. So everything is very individualized. And in order for us to understand what your numbers should be, everything is really tailored to your labs and your symptoms and so on and so forth. This is a great tool. This is a compilation study of hundreds of different studies, and it's a range for men that show us, I use the analogy like a gas tank. Just because you have gas in the tank doesn't mean you have enough gas to get you to your destination, right? So if you have a gas tank that has 300 milligrams of gasoline and you want to go on a 12-hour drive, you're not going to get there. So that's kind of my analogy. Just because we have gas in the tanks does not mean you're protecting yourself from all of these chronic illness and diseases. When we see numbers lower for our men than 900, we see the increased risk of all of these comorbidity factors. That is a problem. So when we're working with men and then we're looking at different types of modalities of treatment, we really have to help them understand there's really only one method that's going to keep you consistently level and work with your body, which is what we're going to talk about today. All right, so moving forward, benefits of estrogen. Now, you notice how on this slide it says there's over 400 functions in the body of estrogen. Notice that I didn't say men or women. I didn't put a label of female on that. The human body, male and female, need estrogen. Of course, we need more estrogen than we do testosterone, and men need more testosterone than they do estrogen. But estrogen with testosterone helps to decrease your bad cholesterol, helps to increase your good cholesterol. How incredible is that with heart health? Right. And when it comes to getting off maybe your statins, there's a better way. Our hormones are designed to help with our lipids. Increase vitality and energy and stamina, motivation, prevention of coronary artery disease, beta amyloid production. This is the precursor to Alzheimer's. Did you know that your hormones work together to prevent that? That's why hormones are so important. Sexual dysfunction, colorectal cancer, glaucoma. Now we're talking about eyes. We're talking about every single body system is rich with estrogen receptors. There's a purpose for estrogen in our body. Tooth loss, osteoporosis. I like to bring up cardiovascular disease for this one reason. We talk about breast cancer, we're going to get there. But cardiovascular disease is the #1 killer in women, and we never talk about it. We only talk about breast cancer, and that's important, and we will get there. Okay, we don't want to downplay that. That's very important. We're going to get there. But 5 times more women die from heart disease than they do from breast cancer. So what are we doing to protect the heart, right? What we do know also is that when women, and this is all backed by evidence-based literature, women who have started hormone therapy early after the onset of them stopping to menstruate, stopping periods, those women saw a 50% reduction in cardiovascular disease. That's a pretty big number. Amazing. Yeah. We also see in studies that the abrupt discontinuation of your menopausal hormone therapy is associated with an increased cardiac and stroke death rate in that first year that you abruptly stop. And it just so happens to be also, there was just something I reshared on Facebook about a study out of Utah, many year study, many women, and the consensus was hormones in your body are good, and even exogenous bioidentical hormones are good as well. As long as you can stay on them because there's only reported benefit. So we'll get there in a minute. Just incredible. We need to start really talking about how we're protecting our heart. All right, so the facts is for men, andropause is kind of like the equivalent to menopause, the stopping of testosterone, the decline. We also call it testicular failure. That is linked to so many different types of chronic illness and diseases, diabetes, high blood pressure, sleep issues, and so many other chronic illness and diseases. And it goes undiagnosed every day, every single day. This is why the majority of our diagnoses are also, later on in life. Right, Dr. Nandyala?
Oh, yeah, absolutely.
All right, so we cannot talk about hormones without addressing breast cancer. Just to Dr. Nandyala's question is that we get a lot of questions about, well, I heard breast cancer is caused by hormones. I can't do it and all this stuff. And I love this topic. I love this topic because I think there's a couple things that we need to understand. Number one, if we heard, if we read, or our doctor said, any one of those three things. If we heard, we read, our doctor said that estrogen causes breast cancer, or fill in the blank, then the first question I ask is, what type of estrogen are they talking about? Because in all of the negative studies, they can use the word estrogen, but if you dig in and critically think and really look at what they're citing, you will find that they are studying a synthetic hormone. They're not studying 17 beta estradiol, which your body makes. So that's very telling. So we need to understand that in studies that may be perceived as negative for our health in any topic, not just breast cancer, what drug are they actually monitoring? Because they use the word estrogen, testosterone, and progesterone like they're all the same drug. And it's not true. That's number one. Number two, the only hormone that was ever implicated in increasing the risk of breast cancer was synthetic progestin, not progesterone, progestin. Now, all of this came from a huge study called the WHI, the Women's Health Initiative. And it rocked the hormone world. Every type of negative study after that always points back from the mother, WHI. Right?
Yep, absolutely.
So, again, are we looking at literature? What drugs are they monitoring? What's the cohort? I mean, there are so many variables that we have to critically think through when we're looking at evidence-based medicine and literature to be able to determine, is this truth or is this bias, or, so on and so forth. So I'm going to go to this next slide and you're going to see what I'm talking about. So last year, so the WHI, the Women's Health Initiative, this is where all this crazy information came out and all these women got scared from this one trial, one study. It really, really hurt this industry, and it's affected many women for many, many, many years because of it. So the lead author of that study came out and wrote an article this last year. And this is the very first sentence in that article. A principal investigator of a landmark women's health study says initial results that linked hormone replacement therapy to breast cancer and heart attacks were misleading and distorted for publicity. This makes me so sick to my stomach because, number one, I'm so grateful that we have some truth coming out about how distorted that study was and how it was misrepresented and misreported. And thank God we have someone that is saying, we were wrong. We got it wrong. We reported on it wrong. So I will tell you, I have thousands of articles and studies that show reported benefits when we're using bioidentical, never any harm. When we're looking at breast cancer, we need to understand the difference between association and causation. If you really want to know what causes breast cancer or what causes heart attacks or strokes or anything for that nature, then what you do is you give the drug and you report the findings. That's the only way you can prove causation. And whenever we give 17 beta estradiol, bioidentical testosterone, and natural progesterone, and all the other things that we do worldwide, there's only reported benefit. So that's something that's really important for us to educate our clients on. And of course, everyone, again, is individualized. And so everyone has a different history. And so we have to take all of that into consideration when deciding how to treat each individual patient. So that's estrogen. Testosterone, that's the powerhouse hormone. Even though estrogen has 400 function in the body, testosterone is the hormone for women and for men. Women will actually produce more testosterone in their lifetime than they do estrogen, which should tell you testosterone is pretty important. There are thousands of receptors in our brain, which would explain, head injury, decline, damaging receptor sites, all that stuff with testosterone, just depression, anxiety, mental nervous disorders, all of that occurs here in the brain, right? So testosterone really, really rich in the brain. Did you have something that you wanted to say, Dr. Nandyala?
Yeah, and that goes in with earlier you mentioned personalized care. So every patient's history is so different. And somebody that could be already taking hormone replacement therapy, synthetic or bioidentical, they walk in and say, well, I've been on this for years, but I don't notice a difference because my doctor says I have to be within this range. And what you're saying correlates, it's individualized. We have to go back and see like any head injuries or any kind of traumas, any infections that have affected the testicular health. There are so many things that do play a big role. Prostate health, that plays a big role in the hormones too. So you're right on that.
Absolutely. So testosterone, again, along with estrogen, protects the bones, the brain, the breast, the heart, the joints, and of course, relationships. We'll talk a little bit about some of the benefits that we see testosterone right here in this slide. Again, with estrogen together, decreasing your bad cholesterol, increasing your good cholesterol, the ability to help build lean muscle mass and decrease fat mass. Did you know that testosterone is an incredible hormone to attack the dangerous visceral fat that I would actually argue is the biggest culprit to many cancers that are diagnosed? It's that dangerous visceral fat around our organs that are really a big causation of many, many diseases. So testosterone is incredibly important to help address that. Mood, overall sense of well-being. Testosterone is highly breast protective. The two best hormones, testosterone and progesterone, are the two best hormones that help protect the breast from breast cancer. Period. So you see a lot of the similarities, Dr. Nada. You see Alzheimer's, beta amyloid production prevention, depression. Of course, we have prostate cancer here, diabetes and insulin resistance. Even if you're not diabetic, do you know how many people are walking around with insulin resistance and don't even know it? And that's what testosterone helps with, amongst other hormones, vitamin D and thyroid and some of the things that we'll be talking about. But together, synergistically, testosterone and estrogen and progesterone, all of our hormones are so incredibly important. I'm not going to go over all of this, but here's some myths and misconceptions. When you go and talk to your doctor and they say, oh, you don't need testosterone because you're a female, they just don't know what they don't know. And so we have to look at the evidence. We have to look at the literature. What does it say about testosterone in women? And is it going to turn us into a man? Is it, going to do this? Is it going to do that? And so this is actually a slide from a study that is incredible. It's by Rebecca Glaser, Glaser. And inside this study, she goes over the top 10 myths and misconceptions that, healthcare providers think about testosterone in women. And she backs that up with tons of evidence-based literature that is just really undisputable. It's just incredible. We started understanding that we needed testosterone in the 40s. We knew that we needed estrogen in the 30s. So this dates back to long time ago. All right. So progesterone, and we're almost actually at the end, but progesterone is another incredible hormone. Progesterone is a precursor. It works in synergy again with estrogen and testosterone. Progesterone helps moderate the excess estrogen, if you will. When we look at we have fluid retention or bloating or headaches, migraines, bleeding, fibroids. Progesterone is one of those things that say, I'm going to keep you at bay, estrogen, right? And so working with testosterone, where one of those hormones helps to prevent breast tissue overgrowth while the other one pushes it down, the combination is the best two things that we can have for our breast. Of course, just like Dr. Nandyala said earlier, progesterone is incredibly important to our bones and many other body systems. And so here is the myth. The myth is you only need progesterone if you have a uterus and you're doing HRT.
Absolutely. I've heard that many times. After hysterectomy, the doctor say, well, you don't need it anymore. You don't have your ovaries. You're good to go. That's right. Not true.
And so in that sense, I say, well, do you still have a heart in your chest? Do you still have a brain in your head? Do you still have bones in your body? If you answered yes to that, then you need progesterone, because why in the world would there be progesterone receptors in those areas of the body and those systems of the body if those systems and body systems were not supposed to receive progesterone? So it's quite telling.
And I like to tell patients progesterone is actually called our happy hormone. I would like to call it as a happy hormone because it helps with anxiety, depression, mood disorders, PMS, anything that you're feeling down right before your period or during the period or after. It's great. And for sleep,
100%.
it's great for sleep, insomnia.
Yeah, so you can see some of these functions here. I mean, who doesn't want this? You know, it helps inhibit breast tissue overgrowth. Like I said, it helps increase your metabolism, promotes weight loss. Hello. It acts as a natural diuretic. Again, when you have that excess estrogen that might be having a little bloating feeling, that's what progesterone's job is to do. So with or without a uterus, that could still happen. You know, depression, anxiety, all of them work together. Of course, if you're postmenopausal and you are getting hormone replacement therapy, you have to have progesterone to really help prevent the excess uterine lining build up. And so that's something that's very important. But with or without a uterus, your body needs progesterone. So very, very important hormone for women, not for men. It's very inflammatory in men. And going into our close here pretty soon before we start talking about the modalities, we look at so many different areas. We look at thyroid, we look at chronic fatigue syndrome and fibromyalgia, we look at metabolic and nutritional deficiencies, we look at your toxicity, your DNA, if you're insulin resistance, PCOS, gut health, intestinal permeability, psychiatric. These are all things that our doctor here digs into, because it's not a one-size-fits-all magic bullet. And so if there's other areas going wrong in your body, we do have to address those so that the hormones can act properly in the body and metabolize properly in the body, correct?
Absolutely.
All right. So what is the best treatment for hormone balance? There's a lot. Dr. Nandyala said, you know, there's pills, patches, creams, injections. Here's some pictures right here. So we have oral where you take a pill. We have creams where you rub them on your body. We have patches where you stick them on your body. We have injections where you inject them into your body. And, you know, one would argue that something is better than nothing, right? But I just want to submit for your consideration how the body operates and how the body recognizes hormone levels and what it did way back when you were producing hormones like you should have been producing hormones, and how all of these are just kind of not fulfilling those roles. So a little bit of history. When we are under stress, trauma, cardiac activity super up, stress hormones, when all of that is increased, our sex hormones, our testosterone, our progesterone, our estrogen, they come in to save the day and they say, oh, we're going to calm that down. So your body works like this, right? When you are needing something, your body starts producing to calm things down. That's how your body is designed. However, with all of these modalities, something is better than nothing, but with all of these modalities, your body can't regulate how much you need when you absolutely need it. So if I take a pill, I might be at this level right now, but 3 hours later, 4 hours later, 5, I have a peak cycle where at some peak, at the highest level, that's where I'm getting the highest amount of hormone. What if my body doesn't need that much hormone at that particular time? Mm-hmm. And then, of course, you come down. So in all these modalities, you have to constantly do this on a very frequent basis. So you're going to go up and then you're eventually going to come down. So you're never really able to regulate what you need, when you need it, how you need it. And you're always constantly chasing that hormone level because you have to continue to administrate it. Oral medication that you swallow will pass through the first pass of the liver. And so with some people, we see some, I wouldn't say adverse effects, but I would definitely see some things that are unfavorable as far as the way that they feel with oral passing through the liver. With creams, I will tell you that vaginal and scrotal application of creams are really great ways to achieve levels and symptom relief. Not really on the actual skin, because about 40-45% of patients don't absorb well through the skin. So really we're just kind of not getting to where we should be getting. We might get a little bit of achieving levels, but not really as much relief as we need. And of course, you know, the overall protection. Creams also do need to be removed when you are being intimate with your partner, unless you want that transferring to them. When you're holding animals, you know, creams can transfer to other people and animals. So that's something that you also want to consider when using it on your skin versus vaginally or scrotal application. And of course, when you're intimate with your partner, if you don't want your cream, vaginal or scrotal to pass off to your partner, then you're going to have to wash that off. Patches are another option as well. They stick on part of your body. And what we also see is, again, bad absorption. Over time, we see receptors around those patch areas that start to burn out, so to speak, if you will. So again, another option, but just not our preferred. And I think the one that I'm most passionate about is injectable testosterone. Now, this is the big argument, and I'm going to just lay it here for you guys to create your own opinion. Now, once something passes through the liver and your body metabolizes it, it becomes bioavailable. Anything that you do, right? So if you have a injection, it's going to pass through your liver, and in your liver, you're going to take off a protein on that molecule, and that might increase liver enzymes, and then it becomes bioavailable. So a lot of doctors will say, oh, it's bioidentical. But my opinion, my personal opinion, is that if your body has to work hard for it to be bioavailable, and it potentially can increase your liver enzymes and have some unfavorable side effects of conversion, I don't really think that that's natural to the body. So I would consider injectable testosterone synthetic. And that, again, is my personal opinion. Dr. Nandyala, what do you think about that?
I like pellets. So it's my personal experience or personal opinion is I have used creams before and patches before, even testosterone shots. I've used all of them in the beginning of my practice. And what I've discovered or figured out is that the absorption issues. So they've been using for the first 3 months, it works great. Maybe the first 6 months, it works great. And then the absorption starts to decline because the receptors are overused because you're putting the cream in the same place every day, or your shots with the testosterone shots. The hike that you mentioned earlier, yes, right after the shot, the hike goes up, and the next week or 2 weeks, all you would have is an option to go down, but not actually to go up. Okay. But when the pellets come into play, they're amazing because these pellets, these are activity dependent. So you're using based on your activity level, and patients doesn't have to remember them because most of them forget. They don't even give themselves the creams or the troches or even shots. They're painful when you're doing in the muscular tissue. Whereas with the pellets, it's amazing. The absorption is great, and I have seen huge hikes with the total testosterone, free testosterone. Another reason for the not so favorable with the injections is because your free testosterone doesn't go up high. Yes, your total shows up as 1100, 1400, but when I'm looking at the free, it's not even reaching 50% of what I want it to be. But whereas with the pellets, there might be an increase in the total testosterone, but it never goes super duper high, ridiculously crazy number. But the free always goes up to a 90% or even more than a 90%. So that means now the patient is actually using that in their cells. And almost 99% of my patients, they come back and say, Doc, look at my shredded body. I have more energy now. I'm able to lose weight and not gain that water retention. Sleep is better, mood is better. In every way, they're better in that way. And the other thing with pellets, as I mentioned earlier, it's activity. So now they're forced to go to the gym, forced to do work in the backyard, just forced, the more active you are, the better you feel. So even though in the past they were couch potatoes, now they're not anymore. They come out and yeah. So those are all, for my personal experience, I would go with pellets. Of course, it really depends on individual patient. So if they've never been on it and they don't know, well, you're putting a pellet in me, I don't know how it's going to go for the next 6 months, then I would start them off with a troche, like a sublingual, and start off there and see how they react to it and go from there.
Yeah, absolutely. So just like she was explaining, so pellets are kind of like a one, you implant it and you forget it. Pellets are bioidentical. The pharmacy that Dr. Nandyala uses her pellets from, or gets her pellets from, third party tests every lot number. We know exactly what's going in the patient's body. We know it's pure. We know it's going to be as potent as we say it's going to be. And we know it's going to be sterile. That's incredibly important. And I will tell you, not all compounding pharmacies are created equal. Our proprietary formulation also in our pellets help really for longer lasting therapies. So you don't have to remember anything. Women typically last 3 to 4 months on average, men 5 to 6 months, and your body only takes what it needs. So typically just how they work is we just make a very small little poke, and underneath your skin in that fatty tissue, that's where the pellet lays. In about a week to 2 weeks, your capillaries form around that pellet, and as your cardiac input goes up or your rate goes up, or maybe you're under stress or trauma, or if you're going under surgery, then your body will pull from that hormone. It goes directly into the bloodstream, into your cells, and it goes to work. So there's no first pass through the liver. That's why we like it. They will obviously dissolve. We are looking at 17 beta estradiol. So we are injecting inserting what your body used to make. So 17 beta estradiol and bioidentical testosterone. And ours are made from yam. Some others are made from soy. So that's a difference with our pellets. So, we just understand that the body performs best when you do something that simulates how it used to do something a while ago. Does that make sense? So if your body used to produce in that way and secrete in that way, the modality that's going to work best with your body is going to be done the same way. And again, it's all an individualized dose, so we don't get it wrong. We know with each individual patient, based upon their symptoms and their labs and their history, every different types of therapy and treatment plan is going to be different. So pellets are definitely going to be the best bang for your buck. It's also going to give you the highest level of protection, the highest steady levels of hormones, no fluctuations. We don't want our patients to go through that. They're convenient. You don't have to worry about taking something every single day, and they mimic the way your body used to produce. So in closing, before we open it up, if there is any questions, hormone imbalance can occur in men and women at any time. It affects everything around us when we have hormonal imbalance, relationships, not just with your spouse, but with your children and your family and your friends and your workplace. Not all therapies are created equal. We go to an incredible length to make sure that our products and our therapies and our protocols are the most superior, advanced, up-to-date that you could possibly be exposed to. We're always constantly helping to move forward. And Dr. Nandyala has this incredible advanced training background. It's a night and day difference. It really, really is, between her and another physician that maybe doesn't have this type of a background. Hormone imbalance is not a one size fits all. We have to individualize your treatment plan, and I think that's what's so important. All the other modalities, they're one size fits all. Everyone gets the same dose, right? Pretty much. And absolutely. Low to normal labs may not be optimal. And here's what I was going to just submit for your consideration. When I was 35, I told you that story earlier. My doctor said everything was fine. I found out my testosterone level was an 8. My total was an 8. And at that point, that lab range went from 8 to 80. So she said, oh, it's in the range. Even though it was the very bottom number of that range, it was in the range. So I was normal. What that signified is, number one, there's no science behind those reference ranges. We don't have time to get into that. But what that signified was I was operating like an 80-year-old. My level was that of someone that they would expect to see levels of that in the 70s and 80s. So you tell me how good I felt. So that's why we say low normal labs may not be optimal for you. We want you to feel the way you're supposed to feel. And so if you experience any of the symptoms that we talked about, the brain fog, weight gain, irritability, depression, joint pain, muscle fatigue, all of these things, hot flashes, night sweats, the inability to lose weight, the inability to build lean muscle mass, feeling like you're past your peak, erectile dysfunction for guys, low libido for women. If you have experienced those, please understand your body is saying, pay attention to me. And I would submit for your consideration to reach out to us and book a consult with Dr. Nandyala. The very first step is getting labs. We don't know what you may be a candidate for until we get labs on you. So at the very least, I would encourage you to book a consult and get some labs done, and we can at least go from there. So I'm going to go ahead and let you close us out if you wanted to close us out, and we'll be done.
Thank you so much, Jenny. That's amazing. And as you were saying, labs are the most important. And here at Essence, we do a free 10 to 15-minute consultation where patients would come in and say, hey, these are the things that I'm going through. And is there a possibility that you can help me out? Or we can start out with the labs and say, okay, these are the goods and bads and where we can take it from here. And of course, we do use insurance. So patients are most welcome to use any kind of insurance other than Medicare. We don't do in-house labs, but the rest of all the insurances, we definitely do in-house labs. With the Medicare, we send them out to SonoraQuest or LabCorp locations. But as Jenny was saying, labs are the key. So at least it gives you a motivation to see what's going on. Other than that, and it's amazing webinar, lots of information, Jenny, and I hope everybody learned something from this. And if there is one thing I would say, individualized plans. Do not compare yourself with everyone. Like that's a one big thing. Patients come with this lab saying, well, I'm 900 on my testosterone, I should be feeling good, but that's not true, because you are not the same person as somebody else. So let's start with those labs and let's get ourselves more educated and learning the differences between the synthetic and bioidentical, and it's going to be holy grail. It is the key. Thank you so much. I appreciate it. And whoever is participating in this webinar today, they actually are qualified to get 2 cellulite burn treatments. So I'm not sure if you ever heard of shockwave therapy that's we're introducing here in Essence. It uses sound waves to actually burn cellulite down. And that plays a big role with hormone imbalance. So if you have lots of that exogenous like fat tissue, it creates and that plays a role in that negative feedback loop. And who doesn't like a weight loss or a fat loss or inch loss in the beginning of the new year? So you're absolutely welcome to try it out. And also we are doing 2 weeks of free weight loss therapy for patients who participated in the webinar today. So there are a lot of goodies for you to take.
Awesome. Yes. So 10 to 15-minute consult. If you are participating in this webinar, then you have a special little perk that she just talked about. So 2 cellulite burn sessions. And I will tell you, that's awesome. So does that include me? Because I'm participating.
Yes. Absolutely.
All right. So we're going to go ahead and sign off for now. We will send this recording out. Please let us know if you have any questions. Ascends, do you want to go ahead and give them your website or your telephone number for them to jot down?
Absolutely. So you can check out more information at www.essencenaturalmedicine.com, and also our phone number is 480-253-9533, and also we have an Instagram page, Essence Natural Medicine, so you can go on there and get information on new membership programs we have, or new coupons that we give out, or new treatment plans that we're starting to add to our practice. So if you have any questions, please do call 480-253-9533.
Awesome. All right. Well, thank you so much for being here. If I haven't told you before, I just thoroughly enjoy working with you and just being a part of your journey and being by your side and helping to educate patients. And so I just want to say thank you so much. And
thank you, Jenny.
That means
I appreciate your support. You are just go, go, go.
Yes, I am. All right. So we're going to go ahead and sign up for now. Everyone have a wonderful week. Please contact us so we can help you feeling and getting well and living well. All right. Bye, guys.
Absolutely. Here's to health. Take care. Bye-bye.